You're now listening to the Adiel Gorel Show. Each episode I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today on the Adiel Gorel Show.
Just like taking human identical hormones at the physiologic levels and rhythms will not increase breast cancer, neither will taking testosterone give a male prostate cancer. And if you think about it, who gets prostate cancer? Generally speaking, old men.
Fascinating, and also all the external world conspires not to help. For example, coffee is the beverage of choice of most people, and it can be very acidic. In fact, coffee has been implicated in GERD quite a bit. They are even selling stuff, to counter, because you can put it in the coffee, right?
Yes, and about half of people are slow metabolizers of the caffeine. So if you drink coffee even at 10 o'clock in the morning, by 10 o'clock at night, still half of that caffeine is still there, So that for half the population, drinking coffee at any time of the day can lead to disruptions of sleep. And it's amazing what happens in the brain when you're sleeping. When you have proper sleep at the proper time, around 2 a.m., there's a massive increase in blood flow into the brain. It's like amazing. And there's now we know that there's a whole lymphatic system of the brain to basically clean house in the brain, to help get rid of accumulated toxins and to help really heal and rejuvenate the brain. And without proper sleep and that amazing blood flow to the brain, then the brain isn't going to be optimally working, and nothing else is going to be optimally working because everything links to everything. You're not going to make hormones properly. Your immune system is going to be dysregulated, and so on. So, and then the gut. So then you're going to lead down that path of nutrient deficiency. So it's sometimes you say, where do you start? And that's what I deal with my patient population. You start wherever you're going to get cooperation from the patient, because I would love to do it all at once. And I know some people have programs where they say you have to do everything at once, and that's optimal. But realistically, it's hard to help, to force people to say, okay, you're going to change basically everything in your life, what you eat, when you eat, how you work, who you relate to, it's so you have to take the best steps you can and not overwhelm people, because you can see it's like, oh my gosh, this is overwhelming. But you can start with just one thing. Just go to bed at a regular time. Don't eat ultra processed food. Try to eat a breakfast, a lunch, and a light early dinner, and stop snacking to help get your clock genes in order. See the light of day. You can get a dawn simulator if you can't get out at dawn to see the light. Put a sleep mask on at night so that you don't have all these ambient light coming from outside and all the little blinking lights from all the electronic devices in your bedroom, so that you can make it really dark. Because what I didn't mention, when you get that big flow of blood to your brain around 2 a.m., that's when your cortisol levels should be the lowest, and you have this big peak of melatonin, which not only promotes healthy sleep, but melatonin has a whole myriad of functions in the body. Nothing is single tasking. Melatonin is the single most renewable antioxidant, which has huge antioxidant function to reduce free radicals and inflammation in the brain and elsewhere. In addition, it helps with glucose regulation. So all of it, there are binding sites on ovaries for melatonin. The ovaries function improperly if you don't get that big melatonin surge. That's why women who work night shifts often have fertility problems, because the ovaries are circadian and rely on that big surge of melatonin at night to ovulate properly. Everything is interconnected.
So if somebody takes melatonin in a pill form, certain amount, 1 hour before they go to sleep, which a lot of more and more people are doing, is it gonna interfere with the body's own production of melatonin?
Yes, it will. And so in younger people who still have the ability to make normal hormones, they still have functioning, they're for males, their testes are making can make adequate testosterone. Women have still functioning ovaries. I do not encourage, except very short term, like for travel across time zones. And trying to manipulate the master clock. But for daily use, for younger people, I never recommend taking a substantial dose of melatonin. And that the whole trend of less is more, it's really come into play with melatonin. I say take maybe 0.5 milligram of melatonin a couple of hours or so before you go to bed. That is not enough to suppress that big melatonin surge that should occur around 2 a.m. It's sort of a little bit to help suppress your cortisol, because there's this balance between cortisol, which is part of the stress system but essential for life, but it also goes higher if you have stress, chronic stress, and melatonin. There's this integral rhythm between the two. When cortisol goes up, melatonin goes down. Melatonin is up, cortisol is down. So if you take a little tiny bit of melatonin, it might help to suppress the cortisol. Also, if you see the sunset, the colors of the sunset actually promote the reduction in production of cortisol. It's actually relaxing to see the sunset. The colors remember, we're earthlings, we love sunsets, and it actually then promotes the production of melatonin. So long term, in younger people, we don't want to do that. Now, melatonin can be used as a pharmaceutical. That's a whole different thing. When you're using a hormone or a neurotransmitter as a drug, that's not for maintaining general health. That's, a whole special thing. So high doses of melatonin have been shown to help with reducing breast cancer, because it's such a potent antioxidant. But that's a whole different thing, right? When you're using it as a drug. And, so that's a different kind of a ball game. But for general health, I say use tiny bits. When people get older and they don't have the right amounts of testosterone and estradiol, and these hormones are very interrelated in helping the body to make more melatonin. Sometimes we have to use something like a time release melatonin formula because you're just not going to make it. But that's for much older people. So
what does it mean? What do you mean when you say younger and not
so
older?
usually 65 plus, I would say that. Obviously different people age at different rates. And also in my practice, I use a lot of hormone therapy to try to keep things from going down that path of inexorable inflammation and aging. Because once people already, they haven't been on hormones, they've never had hormone therapy, their testosterone for males is super low, their estrogen levels, are non-existent from their ovaries. The reality is that there are many doctors, I'm not actually one of them, but there are many that don't want to give hormones because they say it's too late and so on in the game, and they won't do it. And then what is someone going to do? Everyone can't find a doctor that's going to be willing to go a little bit the extra mile and saying, okay, the science doesn't really support the common practice. We know that these hormones still can do good. They're not out of the body. Once we understand the premise that I gave at the beginning, that the prime directive of life is reproduction, part of aging naturally is loss of certain vital hormones. They're not just sex hormones, they're life hormones. These hormones go down in our ability to produce them, not because it's good for the body, but because reproduction is no longer desired in that age group. The ramifications throughout the body are huge and significant. So in terms of the production of melatonin and quality of sleep, in people who are older, and older is a nebulous term, but we'll say in the 60s and beyond, okay, that the issues of sleep disruptions, of sleep problems, falling asleep, staying asleep are huge. So I personally believe that restoring the levels to physiologic levels of estradiol and testosterone are hugely beneficial for every organ system, including the brain, including sleep. But the reality is that the conventional medical world isn't really there. And they're not treating people with hormones for health. I mean, in fact, unfortunately, just recently, the U.S. Preventive Health Task Force came out with their fifth iteration of their recommendations for hormone therapy for menopausal women. And as they have said in the previous four renditions, the fifth one says the same thing. They are absolutely not recommending the use of hormones for postmenopausal women for health. They're not recommending it for just general health, for a healthy longevity or any organ system. The only thing they're recommending it for is short-term use in women who absolutely must have it because nothing else is working, for suppression of night sweats and hot flashes. So this is very sad to me because we know that in the absence of these vital life hormones, we have deterioration of cognitive function, mood, the ability to sleep, to detoxify, gut health, and so on. Yes, there are some individuals who do very wonderful things with their lifestyle. They eat all the right foods, they are fit, and they have the right genes that somehow get to be 100 with no problems, okay? But that truly is the exception to the rule. And we know that over 2.5 times the incidence of Alzheimer's occurs in females because of loss of estradiol. And we know that there's a great deal of cardiovascular disease. And of course, men have dementia and mood disorders, and all of that links to sleep disorders. So I am pro hormones. But if you can't find a doctor that's willing to give you hormones, what are you going to do? So melatonin, for weird reasons I can't explain, is a powerful hormone slash neurotransmitter, and it's over the counter in the US. It's not over the counter across the world, but in the US it's over the counter. So it can be used as a drug type tool, in order to help facilitate sleep in people who no longer have adequate hormones to help facilitate the production of melatonin. So we do everything we can with lifestyle, and for people who are like 65 plus, sometimes using higher dose melatonin, like say
Such as
3 milligrams, and sometimes even higher, up to 6 milligrams, to sort of try to, and preferably in a time release formulation, so that you don't get this giant surge which sedates you at bedtime, but then you will awaken at 3 o'clock in the morning and can't fall asleep. So these are not physiologic uses of melatonin. But it's just using melatonin to give it for its antioxidant benefits and its sleep promotion, and to suppress the cortisol. So basically, you're using it not as a hormone replacement so much as a pharmaceutical, even though it's over the counter, to try to push sleep, to try to force antioxidant status, and so on. And we have to do what we have to do. Aging is natural. What could be more natural than aging? But it's not really beneficial. That's why, this whole science of healthy aging, longevity science is proliferating so greatly, because nobody wants to get old and decrepit. We all want to get old and be vital and healthy. And so, as long as possible, we want to have quality of life, not just years of life.
So a question.
That we need
I'm
to
sorry.
sleep. No, I'm just going to say we have to do whatever we can to facilitate sleep.
So a question from the male side. Some people would say, well, if you supplement with testosterone, aren't you making the risk of prostate cancer higher?
Well, actually, that has been shown not to be true. I mean, that's a very good question. Just like taking human identical hormones at the physiologic levels and rhythms will not increase breast cancer, neither will taking testosterone give a male prostate cancer. And if you think about it, who gets prostate cancer? generally speaking, old men. Younger men who get it, there's like a genetic issue. There's a lot of issues that need to be looked at. Endocrine disruptors. That's a huge problem for younger people getting cancer. It's pesticides and herbicides and heavy metals and plastics of all sorts and so on that are interfering with normal hormone function. And in fact, young males who have a high state of systemic inflammation, that will suppress testosterone production. And it's like horrible if you get levels of testosterone in a lot of young males. We're talking like in their 20s. Often the levels will be in the 200s. It should be like in the 800s, and it's in the 200s in young men in their 20s. And why is that happening? Because they're living a life of inflammation because of endocrine disruptors, ultra-processed food, circadian rhythm dysfunctions, and so on. And the solution for young males, by the way, this is a really important thing that people know. You should never give testosterone to young males. It will suppress their ability to make testosterone. The only males that should have testosterone therapy are males who have what we would call testicular failure. So, and we can find this out by testing their gonadotropins, their LH level. Okay, so if a male's luteinizing hormone, which comes from the pituitary, is very high, then what does that tell us? That the brain is trying, by virtue of stimulating the pituitary, to get the testicles to make more testosterone, but they can't respond. That's testicular failure. That's like they're done for. Okay, like the equivalent of menopause, like menopause for women. The testicles are no longer going to make testosterone. But if you test the LH and it's low or normal or low, then what it's saying is that the capability to make testosterone is still probably there, but they're not being told. The cells that make testosterone aren't getting the signal through the brain via the pituitary to make testosterone. And that is usually due to neuroinflammation. That's due to a whole host of reasons, like we've talked about, that is preventing the brain from putting out the right signal. It would be the female equivalent of hypothalamic hypogonadism. That's where the brain isn't signaling the ovaries to make the hormones of the ovary. And that is the most common reason in females is anorexia, because the brain is going to shut down reproduction in a woman who has massive nutritional deficiencies and doesn't have enough body fat on store in the storage areas of the body. And in males, the brain shuts down testosterone, which is part of reproduction because you need that to make sperm. It will shut it down if there's too much overall inflammation and chemical status, toxic load in the body. A very unhealthy male, for any reason, will have lower testosterone production. So for those people, we need to try to understand why this is happening and fix the underlying problem. It breaks my heart when I see young males who've been put on testosterone supplementation because their testosterone levels were low, because they usually won't come back. I mean, they're always going to have suppressed testicular function, and that is terrible. You always want to get to the root cause. But once a male, like a female, is not going to make it anymore because their end organ, the testicular function is gone, and it's not going to come back because of the cells in that area not being able to make it anymore, not because the brain is giving them no signals. Those men, and they're usually men who are over the age of 50, they should then look at getting testosterone supplementation unless they want to have a baby, which happens nowadays, in which case they need to look at other things. Sometimes you can do, just like perimenopausal women, there's certain things that you can do to try to get one last breath of life out of those organs, just enough to maybe get some viable sperm for maybe in vitro fertilization or some such, so you don't want to put any male on testosterone who still wants to have a baby ever.
If we go back to the very beginning and we talk about healthy brains, healthy people, younger people, still, you began by saying that the goal is reproduction. The directive is reproduction in completely healthy males and female, young ones, I would presume just based on that, not only the brains would be different, but the strategy in general of how you are in the world will be different. Can you talk about that?
Oh, absolutely. They are very different. So, males and females have different chromosomes. So, the females are born with two X chromosomes, and the male has one X and that cute little Y. And it turns out that most of the genes that work on the immune function of the body, which heavily interlink with brain function, the immune cell control is on predominantly the X chromosome. Now, it turns out during embryological times, both of the X chromosomes in little female embryos are still functioning. And during that time, it could be a few weeks, they're actually programming genes differently than the way the genes are programmed in males. And what happens is they have what they call epigenetic modification, so that the female immune cell system and the whole immune system is quite different. Then one of the X chromosome is supposed to be deactivated or turned off, so that in every cell of the female, only one X chromosome is actually functioning. But it turns out that's not true either, that about 15% of the genes are still functioning in that so-called deactivated X chromosome, and almost all of them are related to immune function. So women have a very, very different immune system than do males. They have more immune cells. Women have more of the innate immune cells like mast cells, macrophages, neutrophils, and so on. And they have more of the B type lymphocytes that make antibodies. So women make more antibodies more readily. They have a more robust immune system to fight off infections and pathogens and trauma. So during the premenopausal years, women survive sepsis and trauma better than do males, because we create a more robust immune response to injury, damaged tissue, pathogens than do males. And when you have proper estrogen, it modulates the immune system. It turns on inflammation. It also turns off inflammation. And part of the inflammatory process is the resolution of inflammation, which includes growth factors to make more blood vessels, to make more tissue, and so on. So human females make more of that. They're better able to heal as well. So, and during pregnancy, why is this all important? Because it's all about survival and reproduction. So say, for example, you had a pandemic and it turned out that 10 females survived to every one male. Well, guess what? Life goes on. The population of the planet can be restored over time. But what happens if only one female survives to every 10 males? Oops, now you got a problem. Okay, so nature wants, if there's a pandemic, an epidemic, that females will survive more than males for the purpose of survival of the species. Now, during pregnancy, you have tremendous changes in how the immune system responds so that it doesn't attack and kill this alien that we talked, the fetus. So you have changes in the hormones. The placenta makes a different estrogen balance than does the ovaries. It makes predominantly estriol. And that particular estrogen binds to one type of receptor, the beta receptor, almost predominantly. And the beta receptor actually downregulates the function of the alpha receptor. And what that all does is it sort of calms down the immune system so that the attack animals, those innate immune cells, the neutrophils, the macrophages, the mast cells, they become more quieted down. They don't produce those pro-inflammatory cytokines. So it's kind of like an immune modulator, like what we give to people with autoimmune diseases that block the cytokines. Well, this is nature's downregulation, the production. That's why many women with autoimmune diseases go into remission during pregnancy, only to flare after the baby's born when the production of this hormone, estriol, is no longer being produced because there's no longer a placenta. So it's vastly different how the immune system works. Now, the immune system also greatly affects the brain. You know, we talk about neuroinflammation. When you have a greater reactivity of the immune system, it's great for survival of infections and it modulates it during pregnancy. But when things go wrong, they go wrong at a greater rate in women. So 80% of autoimmune patients are females because they make more antibodies, they have a more robust response to chronic infections, impaired gut barrier, where you have pathogens coming from the gut into the body itself and triggering the production of inflammatory cytokines, inflammation, and also more antibodies that cross-react with our own tissues, not just the pathogen, but because we all come from the same amorphous pool of DNA, RNA. It's like, they call it molecular mimicry. It's like wrong, failed identity, inappropriate identity, and the antibodies attack our own tissue as well as the pathogen. And that's one of the etiologies of autoimmunity is chronic infections, which can be leaky gut is like a chronic infection. And so we have this greater immune response. Well, that also applies in the brain. We also have a greater response to systemic inflammation, to emotions, autonomic dysfunction, and so on. So women tend to be, when they have hormonal imbalances, far more prone to having this imbalance in their autonomic nervous system, more in the stress sympathetic state and not in the parasympathetic state. This creates inflammation system-wide, and that creates more neuroinflammation. That's why women have much higher rates of anxiety and depression than do males. That's not to belittle the fact that males have plenty of those emotional problems too, but we're different. That's why males have higher rates of schizophrenia. I mean, we're just different in a lot of different ways, but when it comes to depression and anxiety, women have higher rates, but both can occur in both genders. So it's important to understand how the differences that start with our chromosomes and then manifest even more with our hormonal differences, that males and females are different in so many different ways. And when they've done drug trials, for example, up until 2015, the NIH, National Institutes of Health, did not require females to be part of any drug trials. And so they weren't, because females are more complicated. They might get pregnant, they might go in menopause, things happen that don't happen in males, like with the hormone changes. They might go on birth control pills. So anything can change in a female that is not going to be easy to control. And you can't tell women, don't do this, don't do that. They're going to do whatever they're going to do. So they left women out. And not only female humans, but even in mice studies, in rodent studies, they left out the female animal as well. So most of the pharmaceuticals we have, the data really is only applicable to males. And so it's really, and we know that women don't respond the same to drugs. So it's really important to recognize this and not have a one-size-fits-all for males and females for anything.
When we look at the directive of life as procreation, as you began by explaining, it does explain why in older age, some of the systems, it's almost like some designer of us says, well, you know what, it doesn't matter anymore. It doesn't matter. You don't need that. And we are trying to, outwit that kind of logic. But in terms of life strategy for procreation to be successful, I assume the behavioral strategies of men and women would be different also.
Well, I wish we had a lot more data on that. But I absolutely think that we should look at them as different species to some degree and look at what, I would love to see more data looking at what types of meditation or guided imagery work better with males or with females. I have found that with males, biofeedback seems to work better because the males like that data. They want to see, okay, what is happening to my heart rate variability? I need the evidence. Whereas women are maybe a little more touchy-feely. They're like into more of their, like in touch with some of their emotions and so on. And they don't need to have the visual, image of their heart rate variability, whereas men do. And so men often do better, but women need it. But men often seem to get more endorphins produced from heavy exercise than do women, and women often do better with gentler exercises like yoga. So I think we definitely need to look at the male and female differences, and this stuff hasn't really been explored. So I just go by my own observations in my practice as to what works better with what groups and so on, and even age groups. So nothing should be across the spectrum of all the decades of life either, because we know that as hormones change, so do our bodily responses. These are fascinating areas. Once again, 100 years from now, I bet it will all be different.
Dr. Gersh, I have questions and you have data and knowledge that could span another 7 hours here, without even trying. But we will end this interview at this point only because of timing issues, both for you and for us here. But once again, I'm incredibly thankful. I'm awed by your knowledge and depth of it. And thank you, for taking your time to help us, to give us some more. I'm looking forward to seeing you next time.
Well, I'll be back. If you put out the invite, I'm coming, because I love that you have this platform to educate and inform, because this is so important, and I appreciate what you're doing.
Thank you so much. Thank you for joining me today for the second part of our amazing interview. If you didn't catch part 1, don't miss out. The link is in the description below for you. And be sure to click the subscribe button for more videos.